and not.
Wind variable, 4 knots.
The marine forecast for Chesapeake Bay.
In Nairobi's informal settlements like Kibera, Mathare, and Kayole, accessing healthcare is a severe challenge. With just one doctor for over 5,000 people, public hospitals are overwhelmed, and private clinics remain unaffordable. Many families face heartbreaking realities: mothers giving birth alone at home, and children dying from treatable diseases due to lack of medicine, equipment, and even electricity in clinics. Nationwide, Kenya has only 19 health practitioners per 100,000 people, far below the World Health Organization's recommended ratio of 1 doctor for every 1,000 people. Poverty exacerbates this crisis, as 37.5% of Kenyans live in multidimensional poverty, lacking basic health, education, and living standards. Nearly 93% of health facilities in Kenya cannot offer basic outpatient services, according to the 2023 Health Facilities Census. This combination of poverty, insufficient medical staff, and under-resourced clinics means millions of Kenyans are effectively denied the healthcare they urgently need. In the summer of 2021, a quiet story began to unfold in one of the most unlikely places, deep within the heart of Nairobi, Kenya. It began not with grand announcements, but with the humble footsteps of a mother and her daughter. Their names, Dr. Sarah Imam and her daughter. Their mission, to serve.
In 2021, when the pandemic was rampant throughout the world, most countries were pretty much closed down, and I really wanted to do something that summer. As an educator, I do get my summers off, and I explored and discovered Kenya might be a safe place for myself and my daughter to travel to and maybe be able to provide some service. I was trying to find some sort of medical organization, and I wasn't able to do so, but I did find USESCO, and USESCO is a women's empowerment and educational non-profit organization. And I contacted them just to ask them if they had any contacts about medical care, and I met Kingsley, and Kingsley basically said to me that, and Kingsley is the executive director of USESCO, he basically said to me he would be able to set up some sort of mini medical service in a church, and this is much needed because, especially during the pandemic, everything had shut down, and that's how it started.
They had come from the United States, from the Citadel, the military college of South Carolina, to volunteer at a small pop-up clinic nestled in Kibera, the largest urban slum in the world.
In 2021, we received Dr. Sarah Imam. She came as a volunteer, like a medical volunteer. And then when she was working in our pop-up local clinic in Kibera, she was so touched when she saw many people were coming for medication. In fact, what touched her most when he saw one woman who traveled from Busia, almost 400 kilometers plus, to come for the services. So, and then she could able to see a big line. Many people were waiting for her services. So she cried and she said, like, I'm going back, and I think I'm going to come back with my team. I want to help as many people as possible. She could not hide the tears of joy when she could able to see women smiling because of her.
The line of patients stretched far. Twice, around the corner of the building, word had traveled fast. Some had come from just around the corner, others from as far as 350 miles away. One woman journeyed from Busia, having seen a flyer with the face of an American doctor who she believed could help her. Many of these patients had not seen a doctor in years. Some had never seen one at all. That doctor was Dr. Sarah Imam, Associate Professor and Director of Health Sciences at the Citadel Military College of South Carolina. She gave her time, her energy, and her heart for 1 full month. But when she left Kenya in June 2021, something stayed behind.
The very first day I came into Kibera, and there were about 100 people waiting for me at 8 a.m. and they were all applauding me that I had been there, and I just knew that this was my calling, like that I was able to do something to serve others. Towards the end, I started brainstorming that this would be a great opportunity for me to serve others, but also an opportunity to educate my students.
So she went back and said, Kingsley, I'll come back. Kenya has stolen my heart. So I'm going to talk with my Citadel Foundation management to see if you can able to send our students and to come out to help as many people as possible.
I returned in November 2021 to set everything up, and we had our first camp in summer of 2022.
In return, she did. In 2022, her dream became reality. At first, it was just her and her daughter, a simple volunteer trip. But Dr. Sarah saw the need. She believed in the people. She came back, this time with her boss, Dr. Zain, to discuss something bigger, a partnership, a promise, a proposal to do more, and it was approved. The first Citadel USESCO free medical camp was born, and it changed everything. Together, the Citadel Military College of South Carolina and USESCO Africa launched one of the most impactful grassroots medical efforts in Kenya's recent history. The dream of Dr. Sarah Imam came through. In 2022, USESCO and the Citadel held the first medical camp, attended to about 4,000 patients in Mathare and Kibera slums consecutively. The free medical camp was adopted with the objective of health consultation, early screening, disease detection, medicine distribution, and referrals in partnership with the hospitals for further treatment and creating awareness of various conditions.
We've not looked back since. We're doing amazing things. It's growing every single year. We're able to offer more and more every single year.
Dr. Sarah was then awarded the license to continue serving the Kenyan people. Her compassion was recognized globally. She became a hope for many families. The Citadel volunteers came, doctors, students, professionals, traveling across the ocean at their own expense with one purpose: to serve. The following year, 2023, the mission grew. Over 6,000 patients received treatment across Kibera, Mathare, and Kayole. In 2024, the number jumped again: 10,906 people treated, lives saved, communities healed. And this year, around 15,000 have been treated. They called it a level 5 walking hospital. Kayole witnessed an overwhelming turnout this year. Thousands lined up from dawn, hoping to receive the critical care they couldn't otherwise afford.
The most common test we have done here for the past 5 days is UTIs, and then the H. pylori, Helicobacter pylori, and then there's arthritis. Those are the 3 common ailments my team and I have tested here.
The common illnesses that are found here since Sunday up to now, since we started the camp, in pediatrics, in children, is underweight, which is majorly due to malnutrition, and I've also found upper respiratory tract infections. Another leading cases we have found here are allergic conditions, which range from the skin to the eyes up to allergic rhinitis. And The other thing I've also found is congenital malformations, especially the neural tube defects. And on this, I would like to advise the community to be attending the antenatal clinics early so that they get the supplements that are required that will prevent such a congenital malformations.
For many residents, this wasn't just a clinic, it was a lifeline. Children were treated for respiratory infections, mothers received prenatal care, and the elderly was screened for hypertension and diabetes, among others.
Nimeenda hizi process zote za matibabu, nikatibiwa, hata nimepata macho ine zangu za kuona, sikuwa naona vizuri, nimepata madawa za kifua. Madawa zao hata ukiangalia hata zile za zingine nilikwenda kununua kwa duka, naona zao ni mzuri na they expensive. Hata saa zingine kwenda kwa duka ingenisumbua kununua kwa wakati moja.
Dozens of cases were referred for surgery and follow-up, and for the first time in a long time, others could smile confidently again after getting free dental and optical services.
Comparing last year, first of all, we have added more units in our medical camp. Especially last year, we experienced so many children who needed our service. So this year, we have managed to add 2 pediatricians. And also we saw last year there was a lot of cases of orthopedic. So this year we have introduced also orthopedic units. And also we have added more. Last year we had a lot of cases of dental issues. So we managed also to add more dentists in our this year medical camp. And of course also some medicine that we didn't have last year. This year we have managed to add more medicine and to help more people.
Personally naambia watu hapa kuna level 6 hospital because kitu yote unataka, whether unataka kutibiwa mapua, throat, macho, meno, kifua, chochote unataka iko wapi? Iko hapa, na yote ni bure. Na si hayo peke yake, ukishaonekana shida yako ni gani, unatumwa pia kwa pharmacy na dawa ni bure.
In Kariobangi, the air was thick with anticipation. This was the first time the medical camp was being held here, and no one knew what to expect. But word spread fast. Children came holding their grandmothers' hands. Fathers waited patiently under tents, hoping their names would be called. The medical tents became sanctuaries, places where pain was named and for once treated.
Nimefaidika. Kwa hivyo hata sasa dawa unaona moja nimeanza kumeza. Ndio niendelee bado kutumika kulingana na sasa, kama injakuwa ni fedha zangu ningekaa hivyo. Ni vile mmeleta usaidizi, nimeamua nikue nanyi na ndio niendelee kufaidika, kwa sababu hata nimesibeba za viungo, kwa sababu hii gari nikipeleka inaniumiza mazoezi.
Thousands of residents, especially women and children, received care ranging from malaria treatment to gynecological services. And just like Sabina Claudia from Soweto, after experiencing a horrifying gender-based violence encounter which almost led her to miscarry, she found hope again after visiting the camp at Kariobangi. She states after trying to visit different hospitals, she still couldn't bear the pain.
I wasn't feeling so well. Something really bad happened to me. Let's say violence in a way, so it hurt me a lot. So I came here because I was feeling so much pain. Nilikuwa under so much pain. Like nika body inatoka, nika sielewi. I was under so much pain. Yeah. So I just came here, nisaidike.
Kibera, where the journey first began in 2021, felt like a homecoming.
We served for 3 weeks in 3 different locations. The first one being Koyole, the second one Kariobangi, and the third one Kibera. And And with each medical camp, we see a rise in numbers, and we also see a somewhat different population as well. I think the greatest needs are in Kibera, so it gives me the greatest pride to be here, hoping that we can serve the maximum number of patients possible. So to me, the quality of service is very important, not so much the numbers, but we do hope to be able to incorporate as many people as possible.
For the few days we've been in Kayole, that is 5 days, we took statistics of 4,225 patients, which we saw with different diagnoses. In Kariobangi, we took like 5,091 patients. We've been having transfers, that is referrals, for the diseases, several diseases, apart from dental, of which we do the referral and follow-up for the patients.
This year, over 3,000 patients were treated, from simple checkups to life-saving diagnosis. The impact was visible in every tear, every thank you, every child running home with medicine and hope.
We have another patient who we had made a referral to Shri Shomenerian Hospital in Langata, where she had a fracture on the index finger, and of which the surgical procedure was done on Monday, and it was successful. And we really appreciate Citadel and USESCO and the patients for the amazing support that they have offered us.
Most of them actually, I realized, they are living with painkillers. Somebody else, like now there's a woman who came, he has a very serious fracture, but she has been living with painkillers.
This year's return of the Citadel USESCO Medical Camp was marked by the highest number of students from the Citadel, the military college of South Carolina. Students trained for a different call, a duty to their country, but this time answering a call to humanity, far, far away from home.
We have the largest group of students that we've ever had this year, 31, and the passion for my team to be able to serve is just so beautiful to see. It's great, and my students are being successful. We've had the greatest rate of acceptances into their programs as well. So I know it's a win. It's a win for my students, it's a win for the community here, and it's a win for everybody that we hire as well locally. So we're hoping we're having somewhat of an economic impact as well.
For the students of the Citadel, this was more than a trip. It was a journey of discovery, of service, and deep human connection.
Today I've been in the ECG room with Dr. Stephanie, and I've learned a lot about how to use an ECG machine.
My experience so far has been nervous, fun, a mix of everything.
I've been working in the pharmacy. It's been a great experience being able to hand out prescription drugs that these people here in Kenya and Nairobi really need and desperately need. These medications are going to help them actually heal and hopefully live a long and healthy life.
Today I've been in the pediatrics center of the camp, and I've seen a wide variety of things coming in, from just like rashes, common colds, to really high fevers. And I've got to see a wide range of things I'd never see back in the States at this camp, and how to treat it properly.
And I have been in triage, pharmacy, and physio for most of my time here, and I've really enjoyed each department and the way they're all very different.
Equipped to serve and ready to learn, some of the students witnessed unique cases which they now term as unforgettable experiences.
You see a lot of malnutrition patients, you see a lot of people dehydrated and needing of nutrients. And so in the treatment and emergency station, basically what we do is we give a whole lot of injections and IVs in order for these people to recover and hopefully get the help that they needed to get.
I have learned so much more besides just the medical field. I have learned a lot about just this culture and these people, and it is the most incredible experience I've ever had.
One of my favorite things is working with the pregnant patients and be able to tell whether it's a boy and a girl on a sonograph. It's just been really amazing and a great experience.
I was in the ortho tent, and this lady that was 73, she could not walk, had osteoarthritis, had to use 2 crutches to walk, and I went and did the steroid shot, and 5 minutes after I gave her the shot, it was an absolute turnaround. She could walk. She even did a little jog with me afterwards.
We had an 8-year-old kid who had muscular dystrophy and really had challenges moving. And unfortunately, there's not a long life expectancy, so that was really challenging to see.
It was a small child, around 8 years old. He couldn't walk. He couldn't barely move his arms, and he was probably 60 pounds, so probably 30 kilograms. And it broke my heart seeing that.
Someone coming in with bone cancer and just having to live with that, because he was a chef. So how is he supposed to walk around and move around when he has that going on in his life? So just seeing how different people are affected by these different cases and diagnoses, it's just something that you have to think about and think about truly, and how we treat it here as compared to in America.
Like painful joints and she couldn't walk, and then she was able to like leave here after getting a single injection in both of her knees. I thought that was very cool. Like life-changing medicine.
I seen someone with a messed up hip implant. They messed it up and his hip bones, his 2 bones were like touching, he had hip pain.
We have a woman here that is 30 weeks pregnant and who was about to go into labor.
11-year-old. And he was complaining of his mouth was really stuffed, and his nose was stuffed, and his mouth was really like dry. So while we were looking at that, we looked at his ears, and we could see that his ears had a lot of earwax, which is a sign also for allergies. And we looked at his nose, and we can see his nose like the gland of his nose were really stuffed. And when I was doing all the when Mike was going through about everything, we used a tongue depressor, and with that tongue depressor, when we opened to see like his tonsils, blood was coming out. So we're like, oh, this is not good. But knowing that he's been dealing with allergies for so long, Michael used a drain method that will help him to free his nose and his throat.
Hailing from Kayole, Lynette Nyanchama Ongeri had for months been battling severe pain caused by nerve issues from her back, which had made it almost impossible to walk.
Nilisikia kwamba leo kuna matibabu huku, nikaona ya kwamba nikuje, na nilikuwa na shida ya nerves ya mgongo. But I thank God nimekutana na madaktari wa huku wamenishughulikia. Sikuwa natembea nikikuja, but I thank God now naweza tembea peke yangu. Yeah, na nimeambiwa kesho naweza kuja. Na naomba waendelee kuwa na hiyo roho ya kusaidia watu wengi.
She says she had visited a hospital before, where the doctors recommended an X-ray, but unfortunately couldn't locate the problem, leaving Lynette to continue suffering with excruciating pain.
Nilikuwa na shida sana ya mgongo. But after Dr. Sarah ameangalia the X-ray, before nilikuwa naambiwa sina ugonjwa, but after aliangalia akaniambia vinye nasikia na it was ni ukweli. That is how nimepelekwa kwa matibabu mpaka saizi naweza tembea na sikuwa natembea.
Her husband, Elijah Ongeri, couldn't hide his joy after learning of his wife's healing and could walk again.
The doctor, who happened to be, her name is Sarah, I don't know, is Sarah. She did a tremendous, she's doing a good job with human in her. And I can confirm that the X-ray we received from one of the institutions in Nairobi, the doctors did not give us the actual readings of the X-ray. They said nothing was there, but when Dr. saw it, She said exactly where the problem is, and without even explaining, she went and touched the problem. So that means this is where now passion and humor meets services.
Irene Nyatuka is a 39-year-old Mathare resident. According to her mother, she has been suffering from cerebral palsy and epilepsy since she was 3 years. In one fateful incident in 2013, she fell and was admitted to Kenyatta Hospital for 3 months, an occurrence that left her paralyzed and unable to speak.
Alianza kuanguka, kufika 2013 akaraswa ICU Kenyatta 3 months. Kwanzia wakati hajaiamka na ajielewe.
Josephine Mongare, Nyatuka's mother, says it has been impossible for her to afford a doctor since she's a single mom and her daughter's medication is very expensive.
Madawa ni expensive. Sile madawa anatumianga Eprim 500 grams, Lamotrigine 100 grams, na Rivotril 2 milligram. So madawa zimepanda bei sana.
She says when she heard the Citadel USESCO medical campus coming to their area again, she felt relieved. Since she attended the last camp, she has not been able to afford a doctor again.
Na nimefurahia wakati mulikuja hapa, madaktari mwezi wa 4 last year walinisaidia sana, wakaninunulia dawa ya miezi 2. Hata saa hii wameniambia wataninunulia madawa ya miezi 3 na waliniambia niongoje. Sasa nafinyika sana kununua madawa, kununua pamba zake diapers, na maisha ndio hii, na mimi ni mimi tu. Usaidizi napata tu kwa watoto peke yao ndio wanasaidianga.
For baby Farhia Naima, it's now a success story after recovering from hernia. In 2024, baby Farhia was suffering from frequent stomach aches, a condition her mother, Farida, who doubles up to be a volunteer at the Citadel USESCO medical camp, couldn't understand.
Alikuwa mgonjwa, alikuwa na shida ya hernia. First of all, sikuwa najua kama kuna shida ya tumbo ya hernia. Nilikuwa tunaenda hospitali za kawaida, tunasema ni tumbo, na yeye mwenyewe anasema anaumwa na tumbo. Tunaenda hospitali za kawaida, tunapewa tu dawa za tumbo, tunarudi nyumbani. Same thing, tunarudi, tunaenda usiku, anakuwa na joto, tumbo, analia tumbo, joto, analia usiku mzima. Tunaenda hospitali, tunapewa tu dawa ya joto na ya tumbo, tunarudi.
After proper diagnosis during the 2024 Citadel USESCO medical camp, she was notified her child was suffering from hernia, a condition which required a surgery.
Wakati USESCO walikuja, medical camp ilikuja, nikaenda kwa daktari, akanielekeza niende kwa Dr. Zara, akaniambia Dr. Zara akaangalia, nikamwambia kuna tumbo, kitovu yake ilikuwa kubwa, akamwangalia sema ni hernia, wakamtake picha, wakachukua picha, wakampea referral, akatibika. After hapo tukaenda, akapelekwa hospitali. Okay, nilikuwa na kitu serious, kumbe ilikuwa kitu iko serious. Kufika hospitali kaambiwa anafaa fanyiwe surgery. Kaenda kufanyiwa surgery. Surgery alifanywa poa, alikuwa successful. Nashukuru Mungu sana. Mali huyo mtoto amenitoa ni mbali sana. Sikuwa najua atafika mali hapo. Mali sahi yako sahi nashukuru Mungu sana, alhamdulillah. Nashukuru sahi yako sawa. Toa mbali sana. Yani hata sijui niseme nini. Umenisaidia sana medical camp USESCO, na washukuru sana.
A year later, baby Farhia has started her early education, and when she grows up, she wants to be a doctor, just like her savior, Dr. Sarah.
Hata ashaanza shule, alianza disia shule Page Lucas, anasoma huko, hako PG, anasoma, anang'ang'ana, hata anasema anataka kuwa doctor or pilot, hizo vitu mbili. Nashukuru Mungu sana. Ako beta, ni clinic tu tunaenda check up hiyo kuangaliwa, anasema bado ndani japona, lakini yuko sawa, anakula vizuri. Hapo mwanzo hakuwa anakula, hakuwa anaika anything kwa mdomo, kwa na kushinda tu vitu ndogo ndogo, akuli aka lose weight. Sasa nashukuru Mungu, sasa weight yake imerudi, iko better.
For some, the impact was deeply personal, not just physical healing, but emotional restoration.
Na niwashukuru sana wale walileta hiyo hospitali washindi kutuangalia.
Thank you, and we encourage you that may you continue coming and may you continue blessing us with this camp. May God bless you.
Nimehudumiwa vizuri, nimeshukuru.
So we have been treated, me and my daughter, and the services are exceptional.
Tunashukuru na tunasema ni asante.
Popote walipo, Mungu awasaidie, awabariki sana. Sisi tumetibiwa.
And to Dr. Sarah.
She's an amazing woman, and I think it all stems from, obviously her knowledge from going through medical school, but also from being a mother. I think she treats us all as her own children.
Thank you for inviting me on this trip, and you're the only person at school that's actually been helping me with my pre-vet applications and getting into schools.
So she's always so kind, she's understanding, she's always there for you to help.
She takes the time with each patient, working at an eye level, making sure they're cared for in every possible way, whether that be emotionally, physically, any way possible. Anything they ask for, she gives. She gives them medicines or anything that can help their ailments.
Thank you, Dr. Zara. I